First aid for seizures. A seizure is a medical emergency caused by a sudden disturbance to electrical activity in the brain, which can lead to uncontrollable muscle spasms and unresponsiveness. Seizures may look different for each patient, but are usually recognized by uncontrollable shaking. Patients may also experience a loss of bowel and bladder control. To treat a patient who's having a seizure, first, protect the patient's airway. Do not put anything in the patient's mouth. Once the patient stops actively shaking, roll them onto their side into the recovery position. This will keep their airway open. Protect the patient from injury by removing any hazards from the area, like hot liquids or sharp objects. Protect the patient's head by placing something soft underneath or around it. Do not restrain or try to hold down the patient while they're actively shaking. As a patient wakes up from a seizure, they may be confused or tired as if waking from a deep sleep. Reassure the patient by speaking in a calm voice and asking bystanders to give space. Note the time and duration of the seizure. The most common cause of a seizure is epilepsy, but seizures can also be caused by things like head injury, diabetes, extreme heat-related illnesses, lack of oxygen, alcohol poisoning, and certain drugs. Call 911 for any first-time seizure, or for seizures that last longer than a few minutes. For any patient who continues to be unresponsive or does not wake up, and for seizures of unknown origin or cause. Always notify a doctor, even if the seizure is caused by a known seizure disorder. To learn more about seizures and the common neurological disorder known as epilepsy, check out epilepsy.com and cdc.gov/epilepsy.